Hi, Lisa Marie Kosis, founder of Global One Health. I decided to do a video series that addresses the anatomical structure and the ranges of motion in a few of the joints in the body. I deem this very important because the better understanding that we have of how these joint structures move and what their proper function is, we can more safely put ourselves through workouts when working out on our own. I started with the shoulder as it's the most mobile joint in the body, and today I want to talk about the hip. The one major thing that these two joints have in common is that they are the same type of joint. As we have a few different types of joints within our body structure, ball and socket is one of them, and both of these joints are an example of that type of joint structure. So while the shoulder is, as I mentioned, the most mobile joint, the hip joint is number 2 in terms of mobility in the body structure. Now, the slight or only primary difference between the two joints is how the ball and socket joint reside in these actual places. So, as I mentioned, a ball and socket joint, right, the head of the bone. In the shoulder, it's the humerus. In the hip joint, it is the thigh bone, the femur bone. The top point of that bone has a ball-type shape, and it fits in the socket into the acetabulum, as it is referred to in anatomy, just the way a plug would fit into an outlet. So it is a really nice design. Now, what makes the shoulder joint a little bit more mobile is that the humeral head sits a little bit more laterally, or a little bit to the outside, not outside of the socket, but just a little bit more to the outer edge. The hip joint, however, has a deeper position, a different setup, is that the femoral head goes up into and sits a little bit deeper into the socket than the arm does into the acetabulum of the shoulder. But again, it is the same type of joint. Ball and socket joint refers to the fact that it is a triplanar joint, which means that both of these joints move in 3 planes of motion. And as I referenced in the shoulder joint, that is the sagittal, the frontal, and the transverse plane. So I'm going to break down what those ranges of motion are very quickly, and then get into a little bit more specifically, because I do talk about that in the shoulder video. But in terms of the hip, I'm going to just show you what that looks like visually, and then we're going to talk, as I did in the other one, a little bit more about the muscle structures that support the hip joint. And then in future videos, I'm going to address a few exercises that are great for strengthening these muscle groups. So we're talking about first, I mentioned sagittal plane first. That is the most common plane that our bodies are familiar with, as that is directly affecting gait, right? So when we walk forward, we are walking in what is referred to as the sagittal plane. So from a side view, the sagittal plane movement would look like this, right? My leg is moving in a forwards and backwards direction. So when my leg moves forward, that is an example of hip flexion. So flexion is the movement referring to the joint. The leg is what is moving in flexion at the hip joint. So that would be, because I'm moving my leg in a forward direction, the prime workers in that forward movement are going to be the muscles that reside in the front of the hip. So that would be your psoas muscle. That is probably the most well-known hip flexor muscle in the anterior side of the hip, anterior referring to the front of the body or the front of the joint, specifically the hip in this context. So the hip flexor, psoas major, is the primary one. Another muscle you may have heard of is the iliacus. Those two muscles work in conjunction. So if you've heard the term iliopsoas, that is a reference of those two very common muscles that are described or utilized in hip flexion. So the antithesis of flexion would be extension, and that is the backward directional movement. The prime workers, and definitely the most well-known muscles of this joint, but probably one of the most well-known muscles in the body, would be the glute muscles, right? The gluteal muscles. So they reside in the back side of the hip joint, but they do wrap around. We'll talk about more of that in a moment. So the glute maximus is the prime worker in hip extension, but probably most well known as it is a major workhorse in squats and deadlifts. But you have 3 muscles that make up the gluteus muscles. So it is actually a muscle group. So you have the Glute Max, the Glute Medius, and the Glute Minimus. And that the names reference the size of the muscle. So the Glute Max would be the largest. It is also the most superficial, which is the closest to the skin. So I refer to muscles, think of them in terms of an onion, which has different layers. So as you get further from the skin, closer towards the bony structures of the body, closer to the skeletal system or skeletal structure, you're moving what we call in the direction of deep, right? So you go from the skin deeper in layer, you're moving in the direction of deep versus superficial. So underneath the glute max, we have the glute medius. Now that is most commonly known to be a hip abductor, which takes me to the next range of motion, right? So we talked about sagittal, the front back direction. Frontal plane refers to the sideways direction. So a jumping jack is a great example of frontal plane movement, right? I'm moving out and in with my legs. So just as in the shoulder, I mentioned shoulder video, I mentioned that all anatomy in the anatomy books needs to have a reference point. So the reference point for all of anatomical purposes is the midline of the body. So the center line, the spine, right, that shin, belly button, pubic bone as the center line. So when we're referring in anatomy to muscles and bones, it's always going to represent the midline of the body. So if I'm moving my leg away from the midline, that is abduction, the prefix AB, abduction, to take away, and moving across my midline. So I could do that, would be adduction. So an example of adduction would be going from center across the body. So that is definitely an example of adduction because I'm using my inner thighs to go across. But if I'm beginning with my leg out here and bringing my leg back in towards center, it is still adduction because I am moving in the inward direction. So just to clarify that specific point. So the prime muscle group that targets hip abduction would be part of your glute fibers. So the glutes begin, right, they do are primarily located in the back side of the pelvis and hip joint, but they do wrap around laterally. So the glute medius is predominantly a hip abductor. Other glute muscles also contribute to that, but that is the prime muscle. I'm not going to get into every single specific muscle, but just some of the general ones for our purposes for this video, general references. So now, the glute minimus also does contribute to abduction. Now, the glutes also affect the transverse plane and are part of transverse plane movement. But I'll get to that, back to those in a moment. But just to finish off, adduction, that's going to be the inside line of the hip joint or the thighs. So the adductors are the prime workhorses for adduction. And we have several adductors. I'm not going to name them all, but there are, it's in a muscle group. So all of the muscles on the inside of the thighs are responsible for adduction. Now, I referenced how the glutes also work in the transverse plane. So important to know that a lot of times it's very common in the body for muscles to have more than one job and more than one function. So the glutes are definitely a great example of that. Now, when we talk about transverse plane movement, as I mentioned, transverse plane is that combination, in essence, of sagittal and frontal plane movement. You put it together, but you're working in a cross-body sense. So what I mean by that is if I combine the front, back, and the sideways movements, I can put them together and I can move my leg in that circular pattern. So circumduction is a great example, of course, of transverse plane movement. Now, there's a couple ways I can show you what that looks like. So what I just did is one example, but even if I don't move my leg out in space and I simply turn my thigh bone in and out in the socket, on that kind of vertical axis, I am still doing transverse plane movement in the joint. So it can be very small. You can make it bigger, obviously, based on your mobility in that joint. But understanding that transverse plane movement is your rotational plane of movement. So, for example, a golf swing is a prime example of rotational movement of the trunk and spine, although hips, shoulders, and such are involved. But understanding when we say transverse, we're really directly referring to that rotational capacity that that joint has. So internal rotation versus external rotation of the thigh bone at the hip joint. So the glutes are definitely involved in external rotation, or the turning out, the lateral turnout of the thighs. So going from a parallel position or a neutral position to here, I would be demonstrating external rotation. Now, if I'm here, I can come back to center, so I have to internally rotate to get me to neutral. But if I were to go beyond neutral, I would be in this internally rotated position. The prime workers of internal rotation of the hip are, while the adductors do contribute a little bit to that, and you'll feel engagement in them, we're talking about the hip joint specifically. So the adductors run from the pubic bone area, from the pelvic floor all the way down to the knee joint, but predominantly your TFL, which stands for the tensor fascia lata muscle, is a prime internal rotator of the hip joint. So again, as I mentioned, muscles can have more than one job and work together to enable a movement to happen at a specific joint. So it's a lot of times a team effort. So that just breaks down the three planes of movement: sagittal, frontal, and transverse plane, and I've demonstrated what those planes look like in each of the joints. I've already kind of segued a little bit along this in this video about what muscles are involved. I'll talk a little bit more about that. And then future videos, as I mentioned, I'm going to show you ways and exercises to specifically strengthen the muscles of the joint structure. And that'll be part of each of the video series of that specific joint. And that's how I'm going to set that up on my channel. So when we're talking about hip flexion, right, that is the moving forward of the leg. Now, if I'm lying on my back and I go into chair pose, which I talk a lot about, that is going to be an example of a way to strengthen the psoas muscles. But a simple march in a standing position is going to be activation of my psoas and my hip flexor complex. And that is probably one of the best ways, is either on your back, lifting your legs up, laying in the supine position, doing straight leg raises. Prime example of how to strengthen the hip flexor muscles. Now, glutes. And I'll just reference that generally in the context of the glute group, but Glute Max, right, predominantly. So we know that just in a very simple way, if I just want to spot target those fibers, I could simply, put a band around my ankles and bring my leg back into that hip extension. Of course, squats, another fantastic example of how to strengthen the glute structure, and deadlifts. Abduction could be the side-lying exercises on the ground with or without a band for resistance. Adduction, there's a way in side-lying as well to lift the leg up away from the ground. But even simply doing sumo deadlifts, right, sumo squats, is just having my legs more externally rotated, and when I come together, I am not just closing my legs, but I'm trying to think of pulling my thighs into each other to get more activation of the adductor complex. If you happen to have access to rotational discs, they are great for working and strengthening the transverse plane movement. Clams are a great example if you're side-lying to strengthen external rotation. You can also lift the foot end up when side-lying higher than the knee, and that will strengthen the internal rotators of the hip structure. But I want to address this, so keep in mind one very important note, that muscles have two basic jobs in the body, right? They have a job of doing the actual work, which is the movement, right? I need to activate my muscles to initiate the movement of my bones, my limbs, or whatever it is I'm trying to do in that exercise. But they also need to act as stabilizers. So if I'm doing a squat, while my quads, glutes, and hamstrings are the prime workers in getting me into and out of the squat, I want to make sure that if I'm squatting, I don't just kind of collapse inward, right? And we know that in squats, hopefully this is a very common thing in the industry that trainers need to address with their clients, is that when I'm squatting, even though I'm moving my legs, right? I'm moving my legs forwards and backwards in the sagittal plane. That is the active plane I am moving in. However, and we know this when we're powerlifting, very, very important concept, whenever squatting, that you want to be grounding the legs down and corkscrewing outward. So it doesn't mean that you completely go into external rotation in the structure. I might be slightly turned out in my squat, just a little bit, but I'm actually trying to more actively increase external rotation as I go down, even though I'm not moving into my end range of external rotation. So I reference this point because one of the primary things to keep in mind when we're talking about the ball and socket joints is because they have that rotational capacity, we want to channel in and use that isometrically when under load in moving in a different plane. So sometimes I need to isometrically engage my transverse plane muscles to stabilize my legs in my joint structure, when under severe load, like a heavy barbell or heavy kettlebell lifts, right? So that is something I think is important just to address as a little footnote at the end of the video here. But thinking about our muscle structures as not just doing the job of moving, moving the limbs and the body within that exercise and to get, through the set, but also understanding the muscles, other muscles definitely need to be engaged and involved to act as stabilizers to create more stability in the joint structure when putting yourself under heavier load. It is a very important concept I just wanted to address. So I hope that's helpful. Understanding how similar these two joint structures are. And again, as I mentioned, the first and second most mobile joints in the body and the examples of the two ball and socket joints that we have.